There are quite a few medical doctors who are certified in TRE. And the reason they got certified is because they recognized that the tremor mechanism was invaluable, particularly for their patients who were in severe pain for multiple reasons, or they were suffering from sort of severe stress and anxiety. And they discovered the tremor mechanism is so easy to activate and so useful for these patients that they've now actually started prescribing it for them to do. Many of them actually do it with their patients in their office. Now, what I have found with medical processes in the human body, particularly with women, if they've had birthing procedures, so if they had a difficult birth, even a natural birth sometimes, they've had maybe a C-section or an epidural, that process of birthing really creates tremendous amount of contraction in the pelvic and lower back area. And women who have used this have found tremendous relief from this. And medical doctors have, in fact, guided them to go through this process to actually resolve some of the pain that they might experiencing post-birth. And it's been extremely useful. So I think medical doctors are one profession that's an upcoming profession that's going to be adopting TRE very much into their practice. I'm not exactly sure how the medical field kind of missed the tremoring process because they see it so often. So you'd have people who EMTs arriving on the scene and somebody's tremoring out of anxiety or nervousness. You have people who are arriving in the office who are tremoring. Many military found themselves tremoring. And we've mistaken the tremoring as being a dysfunction of the human body rather than its natural functioning, which is in fact the process of it reducing the stress and the anxiety that somehow became overstimulated through whatever experience they were having. So I think we have to reframe it and reintroduce it to the medical field, which we can do, because we have to shift the paradigm or the current narrative that tremoring is bad and therefore should be stopped, rather than tremoring is exactly the body trying to re-regulate itself after whatever experience it's been through that overstimulated the nervous system. Now, I just recently returned from China, and I was working with the hospital there and a medical group that are studying TRE, very extensive research project. What they discovered while they were doing it themselves, and this is the medical staff, is they started introducing it to the teenagers that were coming to the hospital because they were having problems with depression, anxiety, maybe diagnosed with ADHD as an example. And what they found is that when they get these young teenagers to tremor, it actually calms them down and regulates them. So they're very surprised by this. But then they added another part to the research, and they are also getting the mother and the father of these children to tremor as well. And they're discovering that they're actually able to rebuild the relationship between the child and the parents by the entire family starting to reduce the stress and anxiety. And they're finding remarkable results in these teenagers and in the parents who are saying they are much more comfortable because they're having to deal with teenagers who might be depressed or suicidal or feeling anxiety. So they're researching not only is the tremor mechanism having a positive effect on the teenagers, but also on the parents and therefore the entire family relationship. It's a remarkable integrated research project and very creative, I thought,